Okay. Good afternoon, everybody. Welcome to our August Food Security Community Call. I'm Anne-Marie Hart Bookbinder with the Food Council staff. We're just going to give everybody a minute or two to come in from the weight room and also for one of our kind of kickoff speakers to get started. So we'll just take another minute, but I hope everyone's been having a good summer. It's good to see so many of you here, considering that it's August. Hope everyone has been enjoying today's not rainy and not sweltering weather. So Casey's always in sync with me on that. Let's see. Okay, I am going to take a quick moment before we launch into our agenda just to recognize two folks on the call today. I'm not putting them on the spot, but I do just want to be sure to acknowledge them. The first is Jillian Berger, who has been with us these past almost 10 weeks now as a Congressional Hunger Center Zero Hunger intern. She's wrapping up her last few days, but this is the first time she's been able to join us on one of these calls. And for those of you who have been connecting with her about your school-based food assistance resource work, I just wanted to acknowledge that here and thank you for working with her on her projects while she's been with us. And so thanks to her for all of her hard work, and we look forward to hearing about what she does in the future. And then a quick, again, not to put her on the spot on her first day, Bita Momeni is going to be our AmeriCorps Vista for the next year. So there will be many, many opportunities to connect with Bita in the future. We will put her more on the spot, maybe on our September call to share some words about herself, but just wanted to put her name out there into the community, and you will start seeing her around as we work very closely together on food security work this year. So really looking forward to that. That being said, I saw that Catherine Nardi has joined us, and so I am going to turn things over to her quickly to get us kicked off with an update from OFSR about the MC Groceries program.
Awesome. Thank you so much, Anne-Marie. Let me turn on my video, but I am here with the Montgomery County Office of Food Systems Resilience. My name is Catherine Nardi. I'm a program manager in our small but mighty team of 4. And I just wanted to take a few moments today to share a little bit about our brand new MC Groceries program that launched in July. We have been working really closely with the Montgomery County Department of Health and Human Services to get this program up and running. This is one of several initiatives that was funded through a special appropriation passed by County Council at the request of the County Executive in December of 2023 to implement the recommendations of the strategic plan to end childhood hunger. And it basically entails providing a monthly grocery benefit to qualifying households in the county to purchase groceries through the Instacart platform using the Instacart Health Fresh Funds benefits. And so we have close to 600 families currently enrolled and actively participating in the program. Again, we worked with the Department of Health and Human Services to identify households that met our eligibility criteria and conduct outreach to those households, as there were a couple of steps in getting them totally on board with the MC Groceries program. And the households currently participating encompass approximately 1,500 county children. There are households ranging from 1 child to more than 4 children engaged in the program, and each are receiving a monthly benefit commensurate with the number of children in the household. So households with 1 child are receiving $100 per month in benefits, 2 children, $200 per month, up to a total of $400 possible dollars per month. This program is slated to continue through June of 2024. We did receive renewed funding through our FY25 budget for the continuation of this program. So I'll pop a link in the chat box to more information for those that are interested and I'm also, in the spirit of today's 0 to 5 age group focus, just pulling up some data to pull from, so I get the numbers right, on the number of households engaged that have children aged 0 to 5. The eligibility criteria included that the households had a child aged 0 to 18 and that they were currently engaged with at least one other county program through HHS. And this is so that they had connections with a case manager or caseworker who could provide technical assistance and support as needed as the program continued and as the households got comfortable with the platform, which is an English only platform. So we wanted to ensure that having that one-on-one support from caseworkers would help to mitigate any issues with language barriers for using the program. So the total number of households, again, is close to 600, just short of 600. And we do have a couple households that are still working out their benefits. So we're hoping to have better participation in the second month of the program. We just, again, launched it in mid-July, so it's still early. But there are, of course, my spreadsheet is like not loading all the way. There are 73% of participants that have at least 2 children in their household that qualify for the program. There are about 98% that have 4 children, 1 to 4 children, and then there are households that have 5, 6, 7, and 8 children also participating in the household, although it's a much smaller share. We also see that there are a lot of households with high numbers of adults, representing most likely multi-generational households or multifamily households. There are a good share of folks in the program that have anywhere from 3 to 10 adults, age 18 to 59. And we also collected some demographic information around current employment situations and the number of seniors in the household. So we do expect to have a growing number of participants in this program over the coming months. And you can see from our website that we're not currently taking any waitlist participants, but when we get to that point, we'll be sure to share it with the Food Council and get information out to our partners to engage as many additional households as possible. But please let me know if you have any questions, and I'll be on the rest of the time. So feel free to message me in the chat box if that's more helpful.
Thanks so much, Catherine. That's really exciting that that program is taking off. Definitely look forward to hearing about how it goes in the future. I do see a question in the chat about how many families can you support with this program total? Oh, sorry, you're muted.
Sorry. The funding that we received through the special appropriation for this initial round of the program was geared towards about 2,000 total. And so once we kind of figured out the logistics, we're seeing that it's probably closer to 2,000 total children that could be supported through the original amount of funding. So like I said, we don't quite have 2,000 children yet using the FY24 funds. And we're hoping to engage additional households. There are still a couple dozen households that are eligible, that received the consent form, that filled out the consent form to participate, and just haven't started using the benefits yet. So we're hoping that between the rest of the FY24 funds and the FY25 funds, we can reach close to, if not more than 1,000 total households, at least again through this initial round that'll go through June of 2025. And once we have more data, we'll be able to create a better case for why we should get more funding in the future to support additional households.
Thank you, Catherine. Again, if any other questions, feel free to add those to the chat, or we can get them squared away at the end of the call or after the call. But thanks for looking at it. Because we are already, good on you, Catherine, a couple of minutes ahead of schedule, I'm going to turn things over quickly to Augusta Frick from the Capital Area Food Bank. She had a few quick announcements she wanted to be sure to share. Hi, Augusta.
Hello, thank you. I am the Maryland Region Partnership Coordinator at the Food Bank, and I just have 3 updates for all of our partners on the call right now and everyone else listening. The Food Bank has a wide variety of county-sponsored inventory currently available free of cost to Montgomery County partners. This includes a lot of proteins and meats, so I want to just say look out for these on the menu and take advantage of this opportunity while it lasts. The second is that many of our partners have not yet spent down their partner credit grants, which expire at the end of August, and our team has met with the county and agreed on a new deadline for these grants. So keep an eye out for a detailed email regarding this extension, which will be sent later this week. The third little plug I have is the Emergency Food Assistance Program, more commonly known as TFAP, which I'm sure you've heard of already, is a great source of government-sponsored food. The food is also free of charge for partners to order and often comes in smaller quantities than we're able to support on our normal website channel. So if you're interested in learning more about that program, feel free to email my team, which you should have all of our contact info. Thanks, Anne-Marie.
Of course, thank you. And Augusta, we'll share those updates in the feedback. I'm sorry, in the follow-up resource. We'll also include your email address. Augusta, for TFAP, is that an option for food assistance providers that are not already partnering with Capital Area Food Bank, or is that just an open call for current partners who are not already doing TFAP?
Great clarification. You have to have been a regular Capital Area Food Bank partner first, and then you can move into that program.
Okay, great. Thanks so much for that
Thanks.
clarification. Okay. All right, moving right along. I am thrilled to start the presentation portion of our call, focusing on the 0 to 5 community today. We are going to kick things off with Carrie Fassett from the Greater DC Diaper Bank. Carrie, thanks so much for joining us today.
Thank you so much for including us in this call. I think this 0 to 5 space, it's so important that everybody who's in it is learning about what's going on and what other organizations are doing. I do have some slides. I don't need to share them. I'm happy just to kind of talk through, and if there's visuals people want to see, I can absolutely put them up. But what I'd love to do is just explain a little bit about who we are, what we do. I do see some familiar names on the call of existing partners, people we're already working with. So this will be certainly some repeat information for them. But the Greater DC Diaper Bank was founded in 2010, and our mission is to provide a reliable source of diapers and other basic hygiene items to families who need them in the greater DC metro area. And so in Maryland, that means Montgomery County and Prince George's County. That means DC proper. And in Northern Virginia, that's the city of Alexandria, Arlington, Loudoun County, Fairfax County, Prince William County. I always forget one of them, but I think I got them all. So it really is the greater DC area, and we work with partners throughout that region. And we have 4 main programs, so it's not just diapers. That is our largest program, our diaper distribution program, which is sizes newborns through 6. We also have a what we call a baby and essentials pantry, which is sort of everything else that you need for baby, plus everyone who lives with baby. So that is wipes, formula, period products, household cleaning supplies, adult hygiene, baby hygiene, books, sort of all the other essential hygiene products and some extras that we know families need. We have a nursery project program, which is a gear-based program. This is a much smaller program and is separate from diapers and the baby pantry. And this is a one-time distribution for a family that has just delivered or is expecting. And that is a pack and play, a car seat, a baby carrier, a stroller, and a fully stocked diaper bag. And then finally, our 4th program is called the monthly, and that is specifically to get period products out into the community. And so that focuses specifically on pads and tampons and liners, and those go out through, the majority of those go out through our baby pantry. So those are our 4 programs. Again, the first program and the central program is the Diaper Distribution Network. And we work with partners throughout, as I mentioned, all of the greater DC region in all of those counties. We have over 90 partners now, I should say partner accounts, some of which are on this call. We work with both smaller based community partners who are doing comprehensive services with families in early childhood education, in prenatal and postnatal care. We also work with larger partners who are doing food-based distribution. Those are our bigger hubs, many of which are on this call. And so families can go to those sites and get diapers and food. And we right now serve around 10,000 families every single month. That is an increase from around 2,600 families in 2019. We grew exponentially during the pandemic. And we, in 2023, served over 42,000 babies in the region. So we've seen a lot of growth over the last 4 years alone. And what we know is that while we're doing a better job of meeting the need, we're still kind of just scratching the surface when it comes to diaper need. And we've spent a lot of time working on our diaper need model and really trying to quantify at a hyperlocal level what the need is. And we use that data, we use that model to help us grow strategically and fill in our gaps. And we brought on 8 new partners, which was at the beginning of 2024, which was the first time we were able to do that really since we geared up from the pandemic. And we used that need model to help us target those areas where we were either not sending any diapers at all or sending very, very few. And that is our approach going forward as well, in terms of trying to be more equitable about where we're sending diapers and filling in those gaps. And then getting honestly creative about how we solve diaper need, because it's, as you all, I'm sure, well aware, it takes many, many hands, and we're scratching the surface. So now in Montgomery County, we have amazing partners. We've got 20 partners in Montgomery County, 11 community partners, which again are those smaller community-based nonprofits providing comprehensive care over 15 different types of service areas. And then we have 9 hubs, which are our bigger sites that are co-located with food and diapers and other things. 7 of those hubs are the service consolidation hubs that we worked with the county specifically on, which is an amazing model. And we get so many amazing diapers out that way. And with those 20 partners, we estimate we are meeting not quite 30% of the need in Montgomery County. And how we determine that is we use census data. We look at we estimate the number of children under the age of 4 living in households 200% of the federal poverty level. We compare that to the average number of babies we're serving by zip code every single month. And that's data we collect from our partners every single month. So yeah, there's room to improve there, for sure. There's room to improve everywhere. But that right now is how we're measuring, at least, an estimate of the need and how we're doing at meeting it. I mentioned we've got 20 amazing partners. What else do you guys want to know? Our partners are guaranteed their diapers every single month. And so when we are bringing on new partners, we have to make sure we have the capacity, inventory, staff time, warehouse space to bring on new partners. Right now, I know one of the questions I'm sure I'll get is, when are you bringing on new partners? Not this year. We're not sure quite when we're going to be able to bring new partners on yet. Because we guarantee those diapers. You order your 5,000, 10,000 plus diapers, you're going to get them. We need to make sure we can guarantee that. Again, we're hopeful maybe next year. We're just not quite sure yet. Building, capacity is always a challenge for nonprofits. I will say, and just be fully transparent, we are, while we are not meeting the need in Montgomery County, we're doing a better job there than we are in other counties around the region. And so from a priority perspective, it may not be Montgomery County. for the next round. And it wasn't in the last round. We were meeting 2% of the need in Prince William County. We needed to get some resources there as well as Prince George's County. So just full transparency there when we're looking at the need and filling gaps. I'd love to, I don't want to take up too much time, but I would love to answer some questions if there are any.
So please, yes, if you have a question, feel free to raise your hand. I did see someone had asked in the chat just how to, a list of your programs and who at the group to contact. I know I included a link from your website of where the Diaper Hub locations are. So everyone has that. And like you did mention, thank you so much that we do have a number of providers on the call today who are partners of yours, and we certainly look forward to engaging them as part of this conversation. But is there a way to, how would a resident connect with some of these other programs you mentioned? Does that also happen through the Diaper Bank hubs, or is that reaching out to you directly?
So we play a very small role in connecting families to diapers. We do have all the hubs listed on our website that have directions for how they distribute their diapers. Some are walk-up, some have appointments, some have hours that they are open and are available. Those are the much more open sites to receive diapers. Our other community partners, those are for families who are already enrolled in their program. So perhaps they're getting postnatal care from a medical provider, and they can receive diapers through that program. We work with several county programs through the community partnership. And so families will be connected to diapers through those programs that they are already enrolled in. The hubs are more open and open to the community. There is not an enrollment requirement for those sites, and those are all listed on our website. Families will reach out to us from time to time, and that's exactly the information we share with them.
Stephanie followed up with the question that, yes, we were wondering too. So what about the monthly products and the nursery project items? How would a resident connect with those?
Yeah, so all of the service consolidation hubs in Montgomery County receive period products, and so they will have them. There are several other hubs in Montgomery County that do not have access to the period products. It's a limited product. The county helps ensure that they get those to the service consolidation hubs. The other baby pantry items are available through our smaller community partners, and they receive those items each month. And then the nursery project items, the gear, that is a separate network, a much, much smaller network of organizations. And they request individual bundles for families, specific families, every single month. And there's a separate application process for that. Unfortunately, right now, that program is on pause for the rest of the year. Okay.
If you have any information, Carrie, that you can share with us afterwards that we can share out, I understand, if there are specific providers that residents can reach out to, if you can let us know those. But if there's situations where it's really just the program is the one identifying the people, I understand that's
the hubs are where if a family needs diapers today, go to a hub.
Okay.
That's the purpose of the hubs. The other programs of families will be reaching out to them for other needs, and then they will be receiving diapers through those programs. We are happy to connect families to programs, but that is not our sole function. We are providing diapers to our partners to enhance their programs and to serve the families that they're already in contact with in their communities. Do babies have to be present to receive the diapers? No, they do not have to be present. They certainly can be, and that's the best proof of baby, but our sites do ask for proof of baby. So insurance card or birth certificate, enrollment for childcare, some proof of baby. Can hubs distribute diapers and period products to other smaller community programs or pantries? No, we ask hubs are distributing directly to families.
Okay. And then there was a question about if you had any knowledge of cloth diaper delivery services in the DC area.
I don't know about services. We do have cloth diapers available. We have kits that are available through our nursery project program. Yeah. And we do collect diapers, cloth diapers for families that have completed their use of them and they're in good shape. We will collect those. We have a refurbisher that we work with. It's a nonprofit out in Wisconsin, and they will take all of those cloth diapers and make them like new. And then we purchase those kits and provide them to families who want to cloth diaper over disposables.
Great, great. Okay. Katie, I see your question. I'm actually going to ask Suja to answer that. I think she's on the call. I believe everyone should be eligible, but maybe Suja can clarify there. Carrie, I know you have a hard stop at 1:30, so I appreciate you being with us. Just a quick question for you. When we spoke, first of all, everyone, Carrie, gave me a very great explanation as to kind of how they plan their programming using census tract data. That was just really interesting and great to hear, how they're planning their priorities. But Carrie, you had also shared some information about things that are happening at the state level through Medicaid program. And I know we don't have a ton more time, but if you wouldn't mind just sharing a little bit of that to kind of inspire people's thoughts about something.
Yeah. I'm happy to, because this is very, very new and really interesting. Because of course we have to get creative with how we are approaching, diaper need and food insecurity. And these are some really interesting and new innovative ways that are using Medicaid to do it. In Tennessee and Delaware, two states that are leading the charge here. And I'll start with Delaware because that really is pertinent to the 0 to 5 space. They just through Medicare or Medicaid, starting a new program that will provide a new parent's full supply, or new baby's full supply of diapers for 12 weeks, plus home delivery of food and nutrition for mom and baby, for caregiver and baby. And so again, it's using Medicaid and classifying diapers as a medically necessary item. They're able to provide and meet that family's diaper need for the first 12 weeks. Now in Tennessee, they're taking a different approach. So it's going through their prescription card, and they're providing families with, I believe, up to 80 diapers, 80 to 100 diapers per month, which is about not quite fully meeting the diaper need for a family, but gets, maybe 50 to 75% of the way there, presenting that card at their local pharmacy to get diapers as a medically necessary device. And so I know DC is interested in exploring that approach. We're going to definitely be talking to other jurisdictions about it, because it really is an innovative way to meet the need. Again, should we have to be this innovative? I don't know. But again, some really interesting things happening at the state level around, meeting diaper need, and on the nutrition front as well.
Yeah, really exciting things to hear and follow, and think about how, we might be able to advocate for something similar in this area. So thank you so much for joining us.
Yeah.
Again, thank you so much. Wonderful to learn about all of these resources and ways that families can connect.
And I would just like to plug, while we are not taking partners or starting an application round this year, if you are interested in becoming a partner, please reach out to us. You can just use our general info at greaterdcdiaperbank.org. We will send you the information, a link to fill out information, and you will go on our list. And then when we are able to open up an application round, we will send that out to everyone so that you can participate if you want to at that time. Great.
So
Thank you.
care.
Thank you all so much. And also just feel free to reach out to me at CFACET at greaterdcdiaperbank.org with more specific questions.
Thank you.
Thank you all.
Great. Moving right along, we're going to go into our next presentation, which is from the Children's Opportunity Alliance, a wonderful partner of ours, and we are so thrilled to be joined today by Laura Jerome and Kimberly Pena Molina to talk about their work. For those of you who may not have been familiar with them, they actually did start joining our community as part of the strategic plan to end childhood hunger design and planning process, and have really been a great partner since then moving forward in this work. So I'm going to turn things over to Kimberly and Laura.
Thank you so much. I think I just hopefully started sharing the right screen. Are you see? Okay, thank you. I wouldn't put it past myself to share something you shouldn't be looking at, but I really appreciate the time today. My name is Laura Jerome, and I have the pleasure of serving as the Manager of Strategic Initiatives for the Children's Opportunity Alliance. Kim, why don't you introduce yourself?
Hi, everyone. My name is Kimberly Pena Molina, and I serve as the Early Care and Education Manager for the Children's Opportunity Alliance. Happy to be here with you guys today.
Great, thank you. So if you have never heard of the Children's Opportunity Alliance before, you're probably not alone. We're relatively the new kid on the scene. We were created through legislation to be designated as the Early Care and Education Coordinating Entity for Montgomery County just over 2 years ago, but it takes a minute to start up an independent nonprofit, especially when you have a board appointed by the county. So we are still getting our legs under us to determine exactly how we go about creating change in the community. But we are designed to connect our community to build an equitable, accessible, high quality, and sustainable early childhood system that narrows disparities and puts all young children on a path to reach their greatest potential. So what we're really doing is looking at a systems perspective of all the places and spaces where kids 0 to 5 and the adults that care about them spend their time, and how to better coordinate and connect and make those resources work better for the families so that every young child in Montgomery County has an equitable start in life. So we do that through a number of different ways. We collaborate, we share information, we boost resources. We're really into leveraging data as much as we can and supporting research where it needs to be done, and then ultimately driving advocacy to make that change happen. So what you're looking at is our foundational action plan. If you're interested in exploring that more, it is available on our website. So we've been asked today to talk about what the landscape looks like for our county's youngest children. So I want to start just by understanding a bit more about who they are. So we know that there are just about 75,000 young children 5 and under in our county. 75% of those children live in families where all their available parents work, whether it's a single-headed household or two-parent household with both parents working. Those children have parents who are in the workforce. We also know that over half of these families live below the self-sufficiency standard for our area. So that means that most families in our county need childcare, and they struggle to pay for it. So I want to look a little bit more about family income levels. So the tier language that you're seeing on the left-hand side here comes from the Maryland Blueprint for Education, with tier 1 being the threshold to qualify for free pre-K and childcare scholarship in our state. So that has families that are at or below 300% of the federal poverty level. To put that in perspective, or as a reference point, that's about $90,000 for a family of 4. And best estimates have about 40% of young children in tier 1, and then another 40% in tier 2, which is 300 to 600% federal poverty level, and the remaining 20% of kids in our county in tier 3. But here's the real point I want to make on this slide, is that many of the public support programs set eligibility at different income requirements. I'm sure those of you that work with these systems all know that, and how confusing and difficult it can be for families to navigate. So Head Start, pre-K, childcare scholarship, all have different income requirements. We estimate about 25% of tier 1 children, so again, the lowest income children, are currently accessing publicly funded seats. So that's through early Head Start, free pre-K, or they're using childcare scholarship to cover tuition at a private childcare provider. And then you'll see this line at the bottom. Food assistance programs have some of the lowest income eligibility threshold. So for SNAP, TCA, farms at school, you have to be 130% of federal poverty level. So we think there's about 10,000 kids 5 and under who are in that income range. But given that there's 40,000 kids whose families are, below the self-sufficiency standard and struggling to make ends meet. There's this gap of 30,000 kids whose families are struggling to make it and who don't qualify for assistance programs like SNAP or TCA. So it's interesting to think about how having young children is more expensive for families and how much pressure that puts on those families. To look a little bit more at what we know about food insecurity, food insecurity data is only published for children 18 and under. And so from what we can tell, y'all are doing a great job enrolling children in SNAP and WIC. For them, close to 85% of eligible populations are enrolled in those programs. Families are still struggling to fill in their farms paperwork. That's why MCPS is trying to do different ways to do eligibility and get free meals to whole schools. But post-pandemic, after a lot of the free meals programs ended in 22, nearly, the food insecurity rates are rising. So that's nearly 11% of children experience food insecurity in our county. A little bit more, last data slide for you. When looking at the kids 5 and under, our county has now hit majority non-white. So close to 60% of young children are Black, Brown, and Asian. 42% of the kids 5 and under speak a language other than English in home. According to MCPS, there are over 160 languages spoken by families. And close to a third of the population were born outside of the US. So we do have a relatively large immigrant population in our county. So that speaks to a lot about how demographics are changing for our youngest children and how we might be able to reach those families. So now I'm going to hand it over to Kim to talk about the landscape and how we think about the early childhood system.
Thank you, Laura, for sharing all that fun data. Without it, I don't think we could do much, right? So now let's take a look at what we think the ECE system looks like in Montgomery County. So the system is very comprehensive, covering almost all essential services that contribute to the well-being and development of children 0 to 5 and their families. So adapted from the Build Initiative model, these are the 4 main buckets that we really see the ECE system as. The first one as early learning, which encompasses preschool, Head Start, center childcare, home-based childcare, family and friend and neighbor care. The next one would be health, mental health, and well-being, basically everything in healthcare, oral health, mental health, nutrition, and things like that. The third one would be family support, and that looks like home visiting, family resource centers, peer networks, training and advocacy support. And the last one would be economic mobility. That could be food assistance, housing support, financial support, and transportation. Next slide, please. Okay. Now, if we take a look at the formal early learning, that includes all licensed care, which again could be Head Start, early Head Start, pre-K, childcare centers, and family childcare homes. You can find about 30,000 children out of our 75 children 5 and under by going through just schools or childcare facilities. Now, as Laura mentioned earlier, about 25% of Tier 1 young children are currently using subsidized seats. However, they only make about 24% of the total license capacity. So then we can think, where are the other kids? They're at home with their parent or a relative. There are some nanny share options and au pairs. However, those are more for the economically stable families. So many families who can't afford childcare are using what we called family, friend, and neighbor care, which is basically them leaving their children with a trusted family member, friend, or neighbor at little to no cost. Next slide. In addition to the formal learning environments, families rely heavily on community spaces to further support their children's development. That could look like family involvement centers, Judy centers, the Patty Center, the libraries, recreation centers, as well as the Play and Learn, which is ran by the Montgomery Housing Partnership at some of their apartment complexes. Next slide. Okay. And now we could take a look at the family support and health landscape, which really is just highlighting some of the programs that provide critical assistance to ensure that all children and their families can thrive. Now, these services range from home visiting programs, parenting support programs, health centers, and teen pregnancy support programs. However, we know that not all families use these resources. So when trying to reach families with children 0 to 5, we really have to meet them where they are, right? So where are they? We can find them all throughout the community, whether that's churches, barbershops, hair salons, laundromats, community centers, bus stops, playgrounds, grocery stores. We really have to think outside the box when trying to reach our 0 to 5 community. And now I'll hand it back to Laura, who will talk a little bit more about what's next for the Children's Opportunity Alliance.
Yeah, thanks. I think one disclaimer I want to add is just that the early care and education landscape is constantly changing, and it's also difficult to get a good grasp on for the reasons that Kim mentioned, that families aren't always accessing formal programs and resources. For parents who have young children, it's a really stressful time of life. So it's often quite hard to find them. But and also nonprofits and partners in our community are making decisions all the time. Right now, we're going through some changes as Shepherd Pratt divests its childhood portfolio and is starting to hand off different programs that they ran, like an early Head Start program and the Family Discovery Center, to other nonprofits. So things shift, right? If you think you've learned where families are and who's running what, the next month things will change. But we're really trying to get a better grasp on that and be able to find ways to better share information about who's doing what, where with who, and how to get connected. Not just for the partners who are working with families, but obviously families need that information themselves. So the next step, the next big thing for us at the Alliance is to build a common agenda. This is a duty that's in our legislation, is that we need to work with our stakeholders to build a common agenda for early childhood systems change, where we really outline the strategies that will help us accomplish the results that we want to see in the community. So ways to make sure that families are more meaningfully engaged, that families have that seamless access to programs and resources that they need, that the ECE workforce is fully prepared and supported, and that the whole system is coordinated. So over the fall and winter, we're going to be doing a series of community conversations, both public ones that all stakeholders will be invited to, but also we really want to connect with partners to host conversations with stakeholders. So if you are an organization that has a constituency of parents of young children that come into your space and that feel like that's a trusted space where they could really have some input on changes that need to be made, then we'd love to be in touch with you about how we could come in and have a conversation. And we do have, we will have compensation available for the families that participate in those conversations. So we're looking at that for September and October. I'll put my email in the chat if that's something that you want to get in touch with us about. And then based on all that feedback that we receive, we'll be putting forth a common agenda towards the end of the winter, beginning of next spring, to really just, outline how all of the partners in this space will be working together for change. So I think we'll stop there and allow some time for questions.
Thank you so much, Laura and Kimberly. I'll give it a second in the chat, or if folks want to raise their hand if they have any questions. but I certainly appreciate you sharing about connecting with providers, if they want to be engaged in that community assessment, especially because of their unique reach in the community and families that they are connected with. I did also want to take a second to circle back about the places and spaces slide and the the different folks that we are or the different ways that children in this age group are connecting with some county programs and providers. And I think that there is a really great opportunity here for these spaces to be connected to food security, food assistance and food security resources. And I know our SNAP team, works with or is starting to work with various of these spaces to get the word out about resources. So I just want to highlight that for future discussion. And I'm sorry, I was speaking over my old-fashioned landline, leaving a message. So hopefully that didn't come across too much on this call. Forgot to take that out of the room before we got started. But one other thing I wanted to mention just to get people thinking for our discussion space is the number of slots available for pre-K and Head Start programming. And for those of you who have spent a lot of time with the strategic plan to end childhood hunger, like I did, you may remember that there is a recommendation in there about expanding the seats in those programs, because what we don't talk about a lot is the fact that enrollment in those programs connects children to food resources, right? Because they are receiving lunch at school, they may be receiving breakfast depending on the school site. So we know that there may be many reasons why a family is not able to have their child to participate in such a program, or prefers to keep the child home at that age. But this really is a key selling point that I think we don't talk enough about. It's about that connection to meals throughout the week, and so just something to keep in mind there. I'm going to stop talking for a second, but if anyone has any questions or kind of thoughts on that, or Laura, Kimberly, any thoughts you had there?
Yeah, I think it's an interesting conundrum, right? Of when you talk about, if you want to access kids, the easiest place to access them is informal learning environments. But because it's an uncoordinated system, if you're trying to reach kids in childcare centers, you have about 485 individual businesses that you need to reach out to that are considered childcare centers in our county, right? So it's really not just that easy of connecting with them. But it is certainly for the families that have figured out how to access formal learning, that is a place of stability. And those children, have access to meals and snacks, and other caring adults who are checking in about their well-being and connecting their families to resources as needed. So it is, certainly in our county, we don't have enough space for all the children or families who would want their children in formal learning opportunities. And all the spaces we have aren't filled because families can't afford to pay tuition there. So there's a lot that needs to be addressed to get more kids in stable care. I do see in the chat there was a comment about the incomes, and I'm going to pull that up again. I just want to share, tier 2 is really what we consider the middle class. So this is between, say, 90,000 and 180,000 for a family of 4. And Montgomery County has, created some programs, like the Working Parents Assistance Program goes up to 450% of the federal poverty level, and that gives supplemental childcare vouchers for those families. But right now, tier 2 families are not eligible for pre-K. Clearly they're not eligible for SNAP or TCA or these other income supporting programs. So it's really these, 27,000 families in this middle class that hurt in our county for sure.
Thanks so much. I don't see any additional questions in the chat just yet, but we will keep moving along. And like I said, we're going to kind of circle back to all these things in our discussion after. So we'll keep our presentations moving forward, and I'll turn things over now to Marie Gualtieri from the National WIC Association. And thank you so much, Laura and Kimberly, for your presentation.
Thank you so much for having me here today. I am going to share my screen, and like Laura, I'm going to hopefully share the right one. Great, thank you so much. And thank you so much for having me here today. I'm really excited to connect with everyone. My name is Marie Gualtieri. I'm the Advocacy Manager at the National WIC Association. And for those who aren't familiar with the association, we're basically the membership organization of the WIC program. Our members are primarily WIC staff, anyone from who greets you at the front door at your appointment to state directors who implement the program at the state level. So, and everyone in between. So just really grateful to be here today. I'm going to be discussing just some WIC background, policy, and processes, and I'll be taking questions at the end as well. So this is just the agenda for the presentation, just going into what's WIC, how we're funded, the food package, which is recently revised, and in April, it was announced what the new WIC food packages would look like, government-related pathways for changes, some priorities, and how you can get involved. So what is WIC? So just starting at the beginning with some basics. So in 1974, WIC became an authorized program. Now, a few years earlier in 1969, it was a recommendation that came out of the House, a White House Conference on Hunger. And so that's kind of how it was, really, thought about how are we addressing hunger in the United States. A lot of other programs came out of that conference as well that we have, such as the National School Lunch Program, SNAP, and others. So WIC was also part of one of the recommendations. Now, in terms of the program, it was last reauthorized in 2010 under the Healthy Hunger Free Kids Act, and I'll be talking about that later in the presentation as well, as it's part of like this bigger child nutrition reauthorization package. And so we'll get into that later of how WIC changes can happen. But yes, it was last authorized in 2010. And since the late 1990s, Congress has really given a commitment, a bipartisan commitment to fully fund the program to meet projected caseload. So that means funding the program to make sure that it can meet participants' needs for the year. Now, WIC funding, so WIC is considered a discretionary funded program, so it's a little different than other programs. So for example, SNAP is a mandatory funded program, which means automatically Congress will give the funds to meet participation every year, but WIC, actually the funding is not guaranteed every year. So it's really great that there's that strong bipartisan commitment to fully fund the program, but at any moment that could be lost, right? And then we would have to potentially turn families away at the door and go to wait list and things like that, which obviously we wouldn't want to happen. Now, last year, the fiscal year 2024 appropriations process was the first time in a long time an actual battle for full funding for WIC. So the president releases their budget for the year, and that really kicks off what's called the appropriations process, which is just funding for all government programs. And so what was noted is that throughout the year and throughout the process, we actually anticipated more people enrolling in the program than maybe originally thought from the USDA. So we needed $1 billion more. And so it was quite the time, but we really just wanted to make sure that we wouldn't have to go to wait lists and that no eligible family would be turned away. it wasn't necessarily promised that we would get there and get that extra $1 billion that we needed to ensure those things. But in April, when the Congress passed the agriculture bill that WIC is funded under, it did include the $1 billion. So it was from strong advocacy that those things were able to happen. But every year, we can't just assume that full funding will happen. So now the current status of fiscal year 2025, we are in an area of the process where the House and the Senate have put out their proposals. The House also what they call marked up their bill. So that means the Appropriations Committee has looked at the bill. They proposed any sort of amendments that they wanted to make to the agriculture bill. And it is now the next step is to go to the floor for a vote. We anticipated that the bill would have come to the floor for a vote before what's called August recess, when members go back home for the month. But at the last minute, the bill was pulled from the floor. We don't know why that is. Usually that happens when there isn't enough votes. We do not believe that WIC was the reason why it was pulled from the floor. The agriculture and FDA bill covered a wide array of issues and programs. So it did not pass the floor yet. In the House bill, it provided $7.2 billion for WIC. Now, if we go back to what the president's budget for FY25 put for WIC, it was $7.7 billion. So we see that there's not necessarily the funding there that came out in the president's budget as needed to meet projected caseload. However, throughout the process, the House added language to the bill. There's like the base bill that has all the funding and all the numbers in it. And then there's this other thing on the side called report language, which is just that language that adds on to the bill in different ways. So it might direct an agency to do something, to conduct some research, to do a report on something. But in this case, the report included language that Congress would work closely with the USDA to ensure that at the end of the appropriations process, they will provide the amount needed to fully fund WIC for the next fiscal year. So that is very encouraging, right? It's not the same place that we were in last year. So that is very encouraging language. Now, on the Senate side, the Senate put out their proposal and they, marked up their bills as well. But their bill has not gone to the floor yet either, which is completely fine. In that bill, they gave $7.4 billion in full funding, in new full funding for the program. So on the face value, and this gets a little in the weeds, so I apologize. On the face value of the bill, it includes the $7.7 billion needed to fully meet participation needs for the next fiscal year, which is great. But because it adds in $300 million of rescissions, not all of it's necessarily new funding. So we are saying that it's $7.4 billion in new funding for WIC. But just like the House side, members of that committee have stated their commitment to work closely with the USDA to ensure that the number provided at the end of the appropriations process will meet that participation need. So very encouraging, like I said, not the same as last year. So that is kind of the overview of what's going on right now. Now, what we expect in the next few months, currently the members are away on August recess, so they are back home in their districts and states. When they come back in September, they have until September 30th to pass some sort of funding bill. Now, we don't believe that it's going to be the full funding bill for all the subcommittees for the next fiscal year. What we believe is going to happen is a continuing resolution. And what a continuing resolution is, it takes the amount of money set aside for funding for the current fiscal year, so fiscal year 2024, and it will just extend that to another date that's further along. So we believe that they'll probably, while we don't know yet what that deadline is, it will probably be until after the election. Now, Congress never meets the September 30th deadline, so this is not anything new. But we just hope that it doesn't go too far into the new year, that, you know, our WIC staff are trying to figure out what their budgets are going to be for the following year. So we just hope that, you know, by the end of the year, hopefully an appropriations bill is passed. So we will see. And that is the appropriations process in a nutshell. So something that's very exciting is the WIC food package. So this was revised from its previous WIC food package. This happens every couple of years. What happens is that it goes through this independent scientific review by the National Academies of Science and Medicine and Engineering. And they put together new recommendations for what the WIC food package should look like. And so, so this is a very lengthy process, but we are pleased that in April of this year, they announced what those revisions would be, the USDA did. And so basically, in a nutshell, their package, it offers more choices, more balance and flexibility and support. Basically, it's meeting families where they are today, which is very encouraging, and we are very thrilled by the revisions that were made in the WIC food package. And I know that this group specifically is interested in culturally relevant foods. And so in this specific food package with the updates, they did just that, because it is, like I said, a very lengthy process. And then the USDA goes and they put out their proposed rule, which says, these are all the things we're thinking about. And then there's a public comment period. So they hear a lot from people. And then they might revise it from that proposed rule and then put out their final rule. It was very encouraging to see what they did in terms of culturally relevant foods. And some of that includes adding more non-dairy substitutions options for milk, adding more whole grain options, which is really great. It's what we've been hearing from families. So we're really glad that USDA were, again, able to meet families where they are. It maintains the increased value of the fruit and vegetable benefit, also known as the cash value benefit. This is something that we've had in the WIC program, and during the pandemic, they increased the amounts of the cash value benefit for women, infants, and children. And families really thought, I mean, it was like a lifeline for families. And we saw very immediate, just the impact that that money had towards fruits and vegetable consumption among families. So we were able to see the impact very early from that, which was great. And so USDA has maintained those increased levels, and they also put in like a asterisk there of that those levels will be continued to be adjusted for inflation, which was also very big. So we were very pleased with that. It also lowers the age in which parents and caregivers can substitute jarred infant fruits and vegetables from 9 months to 6 months. So more about that early introduction of some foods. It allows you to, you know, try some. And so yeah. So now we're going to talk about policymaking avenues for WIC. So the first policymaking avenue is legislation. So for legislation, these are just regular bills. So like I said, WIC is a part of the appropriations process, and that's how it's funded. But then there's the authorization side of things, and that's how WIC changes can happen. So, so that could be through the child nutrition reauthorization that I brought up before. And they have the jurisdiction of the Senate Agriculture Committee and the House Education and Workforce or Labor Committee. So those are kind of the two different avenues of legislation. You have the funding portion, appropriations, and then you have the authorization, which is just making actual policy changes within WIC. Then you have regulation. So regulation and rulemaking, the WIC food package would be a great example of this. So regulation is something that is done by the executive agency. So in this case, USDA, and it's how they create or change policy, right? So like I said, for the WIC food package, for example, there's the scientific independent evidence-based review. Then those changes are proposed. They do public comment, right? And then they take those in and then they issue a final rule. Now this final rule then is basically new regulations for the program that are carried out. But I'd like to also preface that too with this implementation period doesn't happen automatically. So they have 2 years to implement these changes. So the things that I brought up with the WIC food package on the culturally relevant foods, like that's not something we're going to see right away. But within the next 2 years, the states will be implementing it. So we'll start seeing changes then. And then we have judicial action. So this one is, so I'm no legal expert, but something that we are tracking currently is the Chevron deference. Gosh, what is time? But I think it was last month or right, that there was this overturning of the Chevron deference. And what the Chevron deference was, it was allowing the court, or saying that the court should defer to the agency, in this case, USDA's interpretation of something, instead of just making legal action or decisions without that input of interpretation from the agency. Now, we don't know what this will do in terms of WIC or any other food programs, but it's something that we're tracking. We haven't heard of anything yet, but like I said, we just want to track it just because it is the agencies that are tasked with implementing these programs. So if their implementation and their interpretation is left out of decisions, you know, we just don't know what may arise from that. So what are some WIC priorities? So first, fiscal year 2025 appropriations, full funding to meet participation. So basically we just hope that Congress keeps its promise to work closely with the USDA so that by the end of the appropriations process, the number in the bill reflects what will be needed to serve projected caseloads. We also saw in the House bill, which isn't in the Senate bill, some riders. Now, riders are things that are, I mean, they ride onto the bill. If that, I don't know if that's the best way to explain it, but basically it's these things that happen that aren't necessarily funding related, but is policy related that can make some changes to things that already are there, right? So an example of this is the WIC food package, right? It was revised, it was released in April. It will be implemented over the next 2 years. We're very excited about it. On the House side, there are then these riders to make changes to the WIC food package. So those are to add peanut containing foods to infant food packages. Currently, they're in older children's food packages, but not in the infant one. And so that is one of the riders. The other one is changing the amount of fluid milk provided. The WIC food package in its revision, what it did was it changed the amount of fluid milk provided based on the redemption rates, but also based on a NASEM's review of the WIC food package. And so there are there's a rider to increase the fluid milk amount that is provided from the revised WIC food package. And then there is a rider finally on requiring state agencies to authorize all forms of fruits and vegetables. So that's dried, frozen, canned, and fresh. And so in terms of these riders, we are just tracking them currently. What we fear or our concerns about the riders is that, you know, these are things that are already being implemented, the WIC food package. And so sometimes the appropriations bill, we didn't even see it pass until April of last year, right? And states would have already been in a year into their implementation processes, and changing these things on the back end is actually really complicated for staff. I mean, even it has to do with their whole technology systems and things like that. So it could be really burdensome to staff, really confusing for participants, and just also interrupt the implementation itself, which could have detrimental effects for participants and families trying to utilize these new revised WIC food packages. So that's for FY25 appropriations. And then, like I said, the WIC food package, we just want to make sure that there are no riders that would interfere with the implementation. So how can you get involved? So we actually have the WIC Action Network, which is a coalition of anyone who's interested in WIC, basically. So it can be people who are part of food councils, or WIC staff, or even there are some representatives from industry there as well. But I put some QR codes on the slide here. It's a video to explain more about what the WIC Action Network is. And then there's a QR code for the meeting registration, so you can sign up right away to get that link and get it on your calendar. Currently, our meetings are bi-weekly. They're usually held on Fridays at 3 p.m. And even if you are unable to attend, we always send out an agenda and then follow-up notes so that you're able to stay in the know. So feel free to register for the meeting and to join us. It's just a really great group, and we're all about, you know, certain action alerts and things of how to get people involved to advocate for WIC. And in terms of actions, we currently have an action alert available to anyone, so feel free to share it with your networks. I put it in the QR code here on the screen for the Take Action today. And so basically what it is a pre-drafted letter to your member of Congress based on the location that you fill out in the form. And it's just going over our appropriations ask, ensuring that Congress works closely with the USDA to ensure that there is full funding at the end of the appropriations process to meet projected caseloads, and then to respect the integrity of the WIC food package and not have any interference with the implementation of it. So then the letter will be sent off to your member of Congress. And we try to get as many letters sent out as possible, because those letters ultimately end up in a priority list for the member of Congress themselves, seeing that a lot of their constituents are, you know, engaged in WIC, or what about WIC that they're engaged with, what they want to happen, what they don't want to happen. And it ultimately can help really put these pressure points on Congress to ensure that there is full funding and there isn't any interference with the WIC food package. So please share that out with your networks. I'll be sure to also follow up with the links with Anne-Marie too. So if you have any sort of correspondence that goes out, it can be linked there as well. We also have a social media toolkit linked on the bottom through that QR code. So if you want to get on social media as well, and be able to share out those asks as well, that is provided for you. And that's it. And so my email is there if you have any questions, or like that you may think of after this presentation. But I will stop sharing my screen and take any questions that you have now.
While we give folks a second, just Marie, thank you so much for your presentation. Just a quick note for those of you, a while back, we did have our local WIC office join us on a call. We talked a little bit about the differences between WIC and SNAP in terms of funding. And just a reminder for those of you, which Marie was touching on in her presentation, is that, you know, for SNAP, that is an entitlement program. And so if you qualify for SNAP, you do get SNAP benefits. But for WIC, because the money is limited, not everyone who qualifies is automatically going to get WIC funding. So there could be wait lists. There could be, so the budget for that really does make a difference in the way that the programs are run just slightly differently on that funding issue. So just something important to keep in mind. If there's no questions right now, we'll kind of move into our community conversation. But if there are, feel free to raise your hand or put them in the chat. And I'm sure Marie can stick around with us until the end of the call and handle any of those. But if not, we can follow up and ask those as well. Okay. So what I wanted to do with the remainder of time that we had today was really have an opportunity for providers to share about any specific programs that you might have or work with that are kind of focusing on this age population. Make sure that everyone in our community is aware of it. I know for the DC Diaper Bank, we did mention that the hubs are connected with that program and are providers for diapers in the county. Also Adventist Services, Rainbow Community Development Center, and So What Else are also DC Diaper Bank hubs. Unfortunately, I don't see that they were able to join us. Marie, thank you so much. I don't see that they were able to join us on the call today, but I know members of a number of the hubs are here. So maybe if there's a little bit that you would like to share about the diaper program, how that works, so other providers, have an understanding of how to refer families to you for those services. Maybe we can start with kicking off there. I know it's Monday, but I'm going to give everybody a second.
Can start us off.
Yeah. Hi, Lindsay.
Hi, I'm Lindsay Wise. I'm the manager of the Community Hope Center at Seneca Creek Community Church. We're one of the hubs. And I can just speak to just the great experience we've had with the Diaper Bank. It's been really great to be able to be in partnership with them. Just in June, we distributed 45,301 diapers in partnership with the Equity Center. And so it's a really great opportunity. You think about the conversation we've been having about young kids, so kids that aren't in school yet. This is a great opportunity when you're able to, and I know they have capacity issues to take on more partners, but thinking about those kids that haven't had all of the communication from school as far as food resources and other opportunities through social workers, and just once they get into school, there's so many resources as far as accessing the needs that they have. And so to be able to connect with these families that maybe don't know about that sort of thing because their babies are still young and no one's in school to provide that information has been really great. I think one of the challenges that we've seen is just like making sure that we're connected with all of the community. I think some members of the community are really connected. We're in Gaithersburg, and it seems like many people, maybe from the same country or speak the same language, tend to tell their friends, but then we always wonder about, how we can make sure we're connecting with more families that maybe aren't connected and don't have that real like social network to get the information about our diaper distribution. So it's been a great resources. We also are participating in a safe sleep program, which we're able to give pack and plays to newborn to like 6 months kids. And so that's been a really great other resource for the community. But I just can speak to they're a great resource if you can get on it as a partner. I know capacity wise, they're kind of at capacity right now, but in the future, I would highly recommend it because it's been, I would say as far as food resources, people sometimes just come for diapers because there is a lot of food in the county where people can get food. We have people that just come for diapers and that's all they get. And so I know it's making a lot of impact and meeting a real need. So that's my little comment about diapers.
Thank you, Lindsay.
Sure.
Any of our other hub providers, feel free to chime in and share some of your experience. I did also share some questions in the chat, that I was kind of thinking about with today's conversation, so in terms of, resources that some of you may have for this population. If you're also just, in the, have the ability to kind of share from your experience working with families, barriers that you're experiencing in reaching this population, opportunities that there may be to increase access to food assistance resources with this population. I think those are all some things that we're happy to have some time to discuss today. And thanks to So What Else for sharing your diaper information in the chat. We'll be sure to log that in our notes. Up County Hub, thank you. Everyone's into writing today. Less speaking. And yes, of course, our SNAP team, does do some very specific work in reaching these families with children from 0 to 5. So please be sure to reach out to them if you have clients with children in that age group in particular. Just because obviously the younger the child, the better the chances that the child was born here, which would, make them, the citizenship status being an issue to connecting with SNAP benefits. So obviously the younger the child, the better the chance that they may have been born here and would be eligible for SNAP benefits. So. Anyone else? Oh, folks, we're happy to talk today. We're happy to we're happy to connect on children's resources. All right, I do have a short poll. This is what I'm going to have to resort to, a short poll. Today, we want to start collecting some more information on how our calls are working to support you. So I'm going to share that now, just very quick. And it is, if you could take a moment to please complete it. We just want to know what type of organization you are representing. If some of the presentations today have made you more aware of programs and services, resources available, if you have a better understanding of those programs and resources, and if you feel like you are, as a result, better able to connect clients with children in this age group to additional resources. We would love to collect some of that information for you and think about what you might need moving forward in working with clients with children in this age group in the future. And while that is going on, if there's any other community announcements, upcoming events that folks would like to share, feel free to do that in the chat or to raise your hand and come on camera and share those. Happy to make some space. Otherwise, thanks to those of you for, Jack, please.
Yeah, thanks, Anne-Marie. Sorry, I was looking for my raise hand, couldn't find it, so I just raised my hand. Good afternoon, everybody. My name, for those who don't know me, my name is Jack Ewart. I'm a staff member here at the Montgomery County Food Council. I just wanted to briefly plug, and maybe Anne-Marie did at the beginning. I was not able to join at the beginning. That we currently just opened up our membership for our council member application for the next 2 years. So the application is, and I'll drop all of this in the chat and make sure it goes in the follow-up email as well. But our application is open through September 6th, and this is to be part of a 2-year cohort from January of 2025 to December of 2026, with then the option to extend for another 2 years. So we have that application open now. Just wanted to give a quick plug to that, and I'll drop all the links into the chat. Thanks, Henry.
Thank you, Jack. I did not have that, so I appreciate the reminder and sharing. And again, we'll be sure to include that in our resource email going out. So if you or anyone that you think would be a good fit to join our food council, please do encourage them to apply and help us continue to better meet your needs. Okay, thanks again to those of you that responded to the poll. If you haven't, I will leave it open for another minute or two, but thank you so much for joining us. We will send out word about our September convening along shortly and hope to see you there. Thanks so much, everyone.